Hi, welcome to the show.
Thanks. I'm so glad to be here.
I love chatting with you. We've done it before, and we're going to talk again about behavior. That is what I think. There's lots of good information on your Instagram feed, but behavior and challenging behavior and when to seek a professional or a therapist is something I think you constantly bring up, and we learn a lot.
I do.
So, I posted on my Instagram, what are the most challenging behaviors, and I'm going to go through the list and then we'll bring it back at some point. But the most common ones were biting, hitting, yelling, and throwing. And I just think back to like my own kids and they all go through it. And I think sometimes as parents we feel like we've done something wrong, and it's just could be part of what happens. But on the other end, I know as a parent I was always questioning, like, at what point should I see somebody? So how about we begin by understanding, like, what do you look for, or what is like a behavior that to you stands out?
Yeah. Well, like you're saying, like tantrums can be, I see all this as part of a tantrum, right? Like a behavioral outburst, and they're normal part of development. Most kids go through it. Some have little short bursts of one here, and then others have longer ones or more frequent ones. So not every kid who has a tantrum needs help, but I do think about, like, if you feel like you're walking on eggshells, if you feel like, okay, I'm changing my daily life, I can't go to the grocery store, like bedtimes are getting drawn out. If you feel like you're changing your life for some reason for these tantrums, and it's becoming more and more common, I'd say that's the time to go seek help.
How long would you wait to decide this? Or is it because maybe parents also thinking, do they grow out of it? What if the child's only 2 and it's disrupting your life? Is it still time to go see somebody, or do you wait?
I think a lot of the times when it comes to like seeing a therapist, we feel like there needs to be, because often they're like in clinics or in hospitals, we think there must be a diagnosis, right? Like my child needs to have that much, disruptive behaviors where they're getting a diagnosis around it to get help. And I just say, like, even if you have something little, if you have a stomach ache and if you just knew what to do to make it go away, why not do it? And I think the same thing comes to tantrums. There's this impression I think we get from the adult mental health world, and with adult psychologists that, like, or the movies, that when you see a therapist, it's like a long extended period of time. But with child psychology, you really don't have to do that. You can go in, I've seen families for 2 to 3 times, really help them get back, get some tools in their toolbox and get back onto the routine and track that they want to be. And then I never see them again, which is great. And so I just say, like, if getting professional help just a few times can make a difference, go for it. It doesn't matter if your child has a diagnosis, just get those tools to make sure that you don't feel the stress of not knowing what to do when they're biting or throwing or yelling or kicking.
I guess that brings up the question, like, what are you doing, or what can a parent expect in the office, right? Like, again, I think you're right on the point that we might think, you only go when something's wrong or there's a diagnosis or you're going to get a diagnosis, but it's more than that. You guys, from what you just said, there's some parenting advice that falls around behavior and maybe things that we can be doing or changing in the environment that would actually make a difference in our child's behavior.
Yeah, I think there's many different ways of targeting it. There's the more traditional way. Usually when those tantrums are happening with other behaviors that makes people confused. And so that might look like, not having those social interactions that kids typically would be having, or hyperactivity, impulsivity. So what I'm talking about is like going to get an evaluation for autism or ADHD, and behaviors are part of the picture. Now that's a drawn out process, right? That's hours to go in, kind of share kind of the developmental history, your concerns, and then hours of testing, and then you wait a few weeks and you get a report. That's one route to do it. Some therapists have like really set kind of courses that they take families through to help kids learn to manage their feelings, help parents learn how to manage tantrums, help kids learn to comply. Learning to listen is a skill, and so that kind of gets bundled in. And those usually look like 3 months of 3 to 4 months of kind of therapy, and those are like a package deal, and you kind of go in and you just get that course of treatment. And then there are things now that are popping up in more primary care settings, for example, with your pediatrician, that they have a psychologist on site, and you can, in some of these clinics, just be able to see them for a couple of consult sessions, and they'll let you know, hey, I'm actually concerned for other diagnosis or possible whatever, and you get pushed, recommended that way, or they kind of help you with managing whatever you're dealing with in a very short-term treatment approach, and then you're out in a couple of weeks.
That's so good to know that support is there. There's a few parents I've spoken with that felt they didn't get that support from their pediatrician. So I wonder if all the pediatricians are aware of that work. Sometimes there's a disconnect.
Yeah, no, it's not available everywhere, unfortunately. And actually, that's a huge part of, I took a recent position at University of California, San Francisco, and that's actually part of my job. A big portion of my job is to help pediatricians incorporate behavioral health for families. And so that is like where psychology is really pushing to make it more accessible to families, because it shouldn't be like this really hard 6-month wait to get in, and then you have to be seen, for the certain amount of time, and then you don't get access to them. We don't want those limitations. We want this information to be more accessible. And so I would just ask around to see if any clinics that in your area, if you're looking for one, have that kind of integrated behavioral health or a psychologist in the primary care setting, but it's becoming more and more popular, which is great.
I'm glad. Yeah, because it is needed. I think of like these really popular parenting blogs, and it's not really the parenting information that we see in research or that you are practicing in your, office with the kids. It's not like the top 10, I don't know, high chairs. Like you need a lot.
Yeah.
Around it. It's the parents'
behaviors.
It's what we've learned, what we need to unlearn. There's so much to it. So you mentioned something that's important, that compliance is a skill learned. I'm sure like a little something went clicked with like parents listening to this, like what? How do we go about that? Because I just picture, one of my kids, and it's like, it doesn't matter what you say. And he's 3, but I know that you have to repeat it. And so a parent now who's like, wait a second, how do I approach this? What advice would you have for them?
This is something, there's things we can do. And also, having a psychologist coaching you, for a couple of weeks really makes a difference. Like one of the things I do is I do a bug in the ear model with families where I'm behind a one-way mirror, or I'm watching them through, Zoom or Teams, and I like have it in my ear to coach them through this. But essentially we want to set our kids up for success, right? So we want to think about, what commands can I give my child that they will listen to? And that might be as easy as like eating a snack that they're not going to resist, and then offer, and having them go get the snack. Oh, thank you so much for listening to mommy. That's the other thing. Praise. Don't praise them for go grabbing the snack. They were going to do that anyways. Praise them for listening to you, and really make that like connection about like, I really love it that you heard what I said, that like right now is the appropriate time for snack time. And so really giving them opportunities and upping the bar. So making it from preferred to something a little bit harder, like putting that blue Lego on the yellow Lego, which they might not have done, but like teaching them through that. And then generalizing that to life. But also, I think with families, we work on like, do you need to be giving commands all the time? No one likes to be bossed around. And so being really, really smart about how we're giving commands, and when we're giving commands, so that when our kids hear like, mom's telling me to do something, they know we mean business, or dad's telling me to do something, we mean business, and we need you to listen. And it's, it's something that is being asked of them to do, and they should do it. So really thinking through helping them be successful, really making success rewarding for them, and then just being really thoughtful about when we are putting that expectation on them really makes a difference.
I love that. I think about also like asking a child to clean up their playroom. And we might not ask, and I know it triggers a lot of people because they're not going to do it. And I think that we have to break it down, and I think you just did now.
100%.
Like there's a way to show them, I guess, the reward and the praise differently, or so how do we I think I'd like to talk about like consequences and also praise and reward, because you just mentioned it. And I think some parents worry, like, am I praising them too much? Are they going to expect it? Where's the balance? So how about we start with the child who's ignoring us and not clean, never ever, like we do it every day. We repeat every single day to clean up their playroom or their play space, and they're ignoring us. Do we implement
Yeah.
consequences immediately? Do we praise or offer rewards for every little thing that they do because they picked up one toy? Like, where's the balance in that?
Yeah, I love that because I think cleaning up a room is a challenge most families
Yeah.
face. And I just think about myself. If I walk into a playroom with a lot of toys everywhere, as a grown adult with organizational capacities who've done this a million times before, I'm still overwhelmed. Like, all right, where am I getting started? And I'm like strategizing and like trying to not step on Legos. Like, it is a huge thing in my head. And I imagine that in a 3-year-old or a 4-year-old or even older children, when we're like, go clean your room, that's so overwhelming for many kids who don't really have what we call the executive functioning to like plan and strategize and initiate that behavior. And so I think about setting up kids for success. So what can we do that makes it developmentally appropriate? Maybe for a younger, like a 2 to 3-year-old, we say, put that blue Lego in the red basket. And so then they're doing that. And then, and then we're helping them one at a time. Or for an older, maybe a 4 or 5-year-old, we're saying, let's put all the Legos in the basket, right? Like, so now we're meeting them at their level and we're teaching them how do we think through all this, and how do we plan and how do we approach this. So I would first just pause and make sure the expectations we have are developmentally appropriate and the language we're using to support them in meeting this expectation is appropriate. And I want to back up and talk a little bit about success. I often just hold in my head, success is like something they can do independently 80% of the time, like 70 to 80% of the time. You want a bit of a challenge, right? Because that's why you're there. You're helping them get better. But if they're only able to clean their room or their Legos 30% of the time, it's telling me it's too hard. And so we need to simplify something so that they can feel that success and feel, the rush of accomplishment when they're able to clean whatever they're being asked to clean.
Yeah, and then ask them to finish off or do a certain part while we help them.
Yeah.
So at least they've done their part and they've been successful at cleaning that area of the room, let's say. Right? Would that be
Exactly? And this might look different for different kids, right? Like some kids need visuals to, sort out what goes where, and some kids need, more of a schedule or bins, just different ways of doing things. And so there might be some problem solving around it, but thinking really again about how do we set them up for success? Knowing my child, what does he or she need to be successful in doing this?
I love that. It's such a positive way to look at it, right? Rather than like, I don't know, like 3 X's or then you're out, kind of thing. Like,
yeah,
them up for success is such a beautiful way to connect with them and to show them, I want you to succeed, like, let's do this together rather than giving them this big role of cleaning up the entire room and then they fail every time.
Yeah.
I get that. That's really nice. Such a beautiful way to see it. So where do, I guess, rewards and
yeah,
you just said is a bit of that praise is that where you want to stop it, or how much do some once they clean their little space?
Yeah, so I love praise. I think praise is one of the most helpful parenting tools. It has some myths and some bad reputation around it because I think I know, and I think it's just because there are some research. There is research out there that like about how we praise. There's some wisdom around it, right? Like just saying good job is like just blowing air in certain ways because it's not telling a kid anything. Like if your boss comes to your desk and says good job and walks on, you're like, for showing up or like submitting that report, like what did I do? And so I think there's like a lot of wisdom around it, but I think it's specific to this situation. When I think about skills building, I think praise and rewards are so good because kids might not feel as rewarded as we do for cleaning up that pile of toys. Like we look at it, it's clean, we feel good. They're still learning some skills. And so we serve as that kind of reinforcement until they're kind of able to more successfully accomplish it. It doesn't feel like such a hurdle. And they're able to just be more, when we're better at something, it's easier for us to do and it gets easier and it gets more rewarding for us. So I think really using that in skills building is great. So when they put that blue Lego in the bin, I am going to praise them and I'm going to praise them for listening. I'm going to praise them for, cleaning up or for whatever skill I'm trying to build. I make my praise really specific to that. And then, And so I do that, and then it's not forever. When they're 15, you're not going to have to, praise them for every single Lego. And you don't have to give a reward. You taper off. Again, that's a success. If they're doing it 100% of the time, then you can kind of taper off some of your praise and acknowledgement. We all really like praise. We all like it when people acknowledge us. Even if we know we're doing a good job, it feels good for someone else to acknowledge that.
I know,
And
just
so
like
our kids deserve it.
And it just, yes, exactly. And even as adults, like you were saying, we like it. It feels good, right? I just the other day, I told somebody, like, oh, there was a document that she handed in, and I was like, you did a really good job. Like, I love how you did this part. And she's like, oh, thanks. That feels good. And it does.
Yeah.
Yeah. And
Yeah.
it does have a bad reputation.
It does.
Because there are different ways of doing it. I think of like a child who scored, like on the soccer field, and you could say like, I noticed you've been practicing really hard and you finally got that goal, and I'm really proud of you, versus like, you're the best player on that team.
Right.
Like,
exactly.
Nobody can beat you, and you're just so good at this. There is a difference in the kind of praise.
There's a difference. Yep. That process praise is so important.
Yeah, the process. I love that. Let's go back a little bit to the four big problems that parents said they had: biting, hitting, yelling, and throwing things. Again, because I think back to my kids, and I went through it with them. So I want parents to, one, understand that it's normal, and two, perhaps have a few tools in their toolbox after this conversation. Let's talk about the difference between a young child, a 10-month-old, and a 4-year-old going through this. Would you approach it the same way? And is hitting, biting, and all that, like, is that something you would go seek help with? Or let's start with that.
Yeah. Aggression, I think safety is always my number one priority for both, not just the child, but also the parent, right? Like, I just told a parent today, it is never okay for someone to throw something at you. Doesn't mean if the person throwing it is a grown adult, or like, your 2-year-old running around, like, that's just not okay. And so, but it happens because kids are learning cause and effect, right? If I bite you, if I pull your hair, if I yell, you have a reaction. Sometimes that reaction gets me what I want, or gets me out of having to do something I don't want. Sometimes it's just I get the attention, I get a hug. Like, there's a lot of reasons, or they're just upset and you're acknowledging it. There's a lot of reasons to it. And so it's totally understandable, especially when they're really young, and they don't have the language yet. They're still learning to recognize emotions and to express it in more helpful ways. So I think one is to start with that understanding, and to deepen your own understanding of why that's happening. So pausing and noticing if there's a pattern is something I often ask parents. I can't remember half the things that happened last week, so I don't expect parents to remember anything. And so I ask them to, jot it down on their fridge or whatever, like, they bit me twice, or they threw toys in the evening, like, starting to kind of see if there's any patterns from being kind of a scientist in your own home, around your child. Yeah, I like doing that because I think there's a function to behaviors. And then if it's happening a lot, then I would definitely go see help. And if tantrums and if aggressive behaviors are getting more intense, and kids are 4s getting into 5s, another reason to go seek out help. Again, you don't need to be bit for 3 years before it's, emergency situation to go get help. You can get it right away. And if you feel like this is something that you're constantly thinking about, like, is he going to throw something at me? Is he going to kick me now? Go get that help for a couple of sessions, and stop worrying about it. So
what happens with the younger ones? Let's say a 10-month-old. Are you disciplining at that age? Are you ignoring it, especially if it hurts? I remember my kids at some point, they would like pinch, like during nursing.
Yeah.
and then like, you'll read sometimes that you should just ignore it, but you're trying not to have a response to it, but it hurts. What should you do when they're very young?
Yeah, I always say keep yourself safe. I think that's the number one thing. So if they're throwing toys, you can ignore and clean up the toys, right? So I just literally have parents. So if kids are hitting and kicking, I just have parents stand up, and I do just like move around the room so they can't have access to my body while I am doing what I do. Or if they're throwing things, I put it away. If they're biting, I remove that body part. If they're pulling my hair, I pull out my hair, tie it back. Prevention strategies are great. So, you know, you wear long sleeves, you put your hair back for a while, you do what you need to keep yourself safe. So that's my first thing. And that happens with siblings too, right? Like they will go after siblings sometimes or other kids, and really thinking about how do we prevent. And I do think ignoring is helpful. Sometimes parents hear it and they're like, I don't want to ignore my kid. And I'm saying, no, we're not ignoring your child. We're ignoring a behavior. It's really, really different. And what I mean by that is like a lot of kids get into these behaviors not intentionally. Like they're not trying to hurt you, or they're not trying to, bite you if they want that candy in the candy store. Like that's not a conscious choice for a lot of the kids when they get started. But sometimes if we react in a certain way, it does become conscious. When I do X, mom will give me Y, or I get out of Z. And so we really want to prevent that by not giving into the thing, and by just really being selective with our attention. And when I mean being selective, I don't mean ignoring behavior and being passive about it. I'm like actively looking for ways to praise them for any kind of, they're quiet, they're crying softer, they took a longer pause to like help themselves calm down. I'm going to praise that, I'm going to acknowledge that, and I'm going to set my expectations. Once you sit down on the floor, mommy will give you a hug. And then I'm a broken record about it, because being a broken record limits your attention to those behaviors while allowing you to hold those boundaries, and letting them know what to move on. So I think it's okay to have some attention in there, which is really selective, and it is consistent. They know if I do this, mommy's going to say why, there's no getting out of this. This biting is never okay. She's always going to get out if I start to bite. So being really consistent about it.
And I think you said something really important there, where we're ignoring the behavior, because I'm thinking of a parent who
Yeah.
have a child who's having a lot of tantrums, maybe a 2-year-old or a 3-year-old. And again, that's developmentally appropriate and not to the point where they think they need help, but it's happening in their home. And sometimes we view those tantrums as behavior. I don't know if I'm looking at it the wrong way, but I always see it as an emotion, and that the emotion itself shouldn't be ignored. But you said ignore the behavior. So how would a tantrum plan? So let's say there's no hitting or biting or nothing, nothing aggressive. So, and it's just an emotion. At that point, do you still recommend to kind of ignore it a bit if they're repeating that because of that phrase of like, if I do X, then mommy does Y sort of thing? Or do you approach it differently when it's really about emotions?
Yeah, sometimes I just think about a majority of tantrums have emotions, right? There's a huge energy to it, and that's why it bothers us so much. If because emotions, they're translatable, and that's why it's helpful for us to keep calm, because then we can help translate that to our kids. But going back to it, I think emotions are really important. And it's fine to acknowledge it. Like, you're really frustrated right now, but I rarely get into all the nitty gritties of like, oh, let me talk through it with you right now. When we're upset, when I'm upset, I cannot hear anything. Like, I am in another world. Yeah.
Yeah. So it's like kind of like being at that peak of their emotions.
Yeah.
Same thing with us when we're really mad and somebody tells us to calm down. It's the worst thing.
No. I'm just going to get more mad at you. So exactly.
Yeah. So it's not that we're ignoring them, but we're offering them what they need at that moment. It's just letting them know that we're there, I guess. And then waiting, like you need to wait for them to come down, right there.
Yeah. And when they come down, you can spend a lot of time in emotions. And I would do that. And I would try to capture it before, the meltdown. Like, sometimes you just know it's coming. Like, okay, I can tell you're getting more frustrated. Like, that's a really great time to like acknowledge those feelings too. And then like at the end, like, okay, I know, I noticed you got really mad around this. And talking about it when they are able to be able to talk more about it, but not in their emotions. So
yes, exactly.
Yeah.
Just for the parents that are listening and who have a younger child, I would even not argue, but say that even 2 or 3 years old, like a child who's 2 or 3, I would still say, even though they might not understand everything, I would still say to repeat it, right? To say like, it's okay to be mad, or whatever it is that you want to say, even if they're older. I think even if they don't understand the whole concept, I think that as they get older and they've heard the same phrase repeated, then they get used to it. And I think that's part of like developing emotion regulation skills, or that emotional intelligence of having heard the different terms of emotions being used in my environment. Like, I know you're frustrated right now, and that's okay, but you still can't hit when you're frustrated. It's like hearing all those different like disappointment and frustration, those are really important vocabulary words to have regard
Yep.
with regards to emotions. So where does like emotions and emotion regulation skills play into all this? We're talking about behavior, but I'm
Yep.
thinking that there needs to be some, when we think of certain situations like transitions or hearing no, that's the emotion regulation part too. Like I think so. How would those specific situations, what would you recommend during those situations?
Yeah, I think two things. First things first, try not to say no. That's my thing. And I'm not saying don't say boundaries. I'm just saying, like, how do we say this in a yes way? So instead of saying no, you can't have dessert, you can say for dessert today, or like ice cream. You can say yes, we can have dessert, but our dessert choices are X or Y. So like really thinking about if there's a trigger, like we all have our buttons, like they're gonna be her buttons. So there are things we're sensitive to. We're humans, and being respectful of that and learning how to navigate that while holding boundaries, because that's really important, and consequences. Yep. Being thoughtful about that is helpful. And my biggest thing is like if there are situations where you are prone to say no or like don't or stop and those negative kind of words. Write a script for yourself and post-it note it there, right? Like if they're always asking for dessert when you're in the kitchen, then write like, this is what I say. You read your script. You don't have to think about it in the moment when you're frazzled. Like set yourself up for success. So that's my first thing is like, let's try to avoid those language. And second part of it is like, think about skill building. I think emotion regulation it's a muscle. It's like how we go to the gym, and like the more reps we build or the miles we run or whatever we're doing, the stronger we get. And the same with kids. And if we're mad, it is not a time to be like, this is a great time to observe, like your heart is beating faster. Like it's not a good time to do that. You can do that when they're starting to be a little bit frustrated, helping them notice signs because they're still somewhat calm. But I do this in other times of the day when they're perfectly, happy and content. And so that means like bringing out a story and talking through the emotions. Or if you're watching a movie, make it a point to be like, oh, I'm noticing so and so, stomping his feet. I think he's mad, and learning it. And it's okay to be mad, like you said, Cindy, but it's about how do we express that we're mad, right? Like punching a wall is not okay when you're mad, but if you need to go take some space, if you need to do other things to help yourself calm down, practicing mindfulness, like that's a time to do it when they are, when they're regulated, and you make it a game. You can have them coach you. Okay, mommy's so mad because she, dropped something on the floor, whatever. What can I do? And then, make it silly. And that's how they learn these skills. And when they are learning and they get practice when it's not so hard, in moments where it's harder, they're able to pull out those tools and be more effective in using them.
We had a calm down corner when my kids were growing up, and they would never use it. And I started using it because I had at that point a 1, a 3, and a 5-year-old. So I would go to the calm down corner every once in a while. My middle child at that point just started going to the calm down corner on his own. And
Amazing.
he wasn't doing it every single time, but I noticed that he would just go there and hang out sometimes. And then I was able to start the conversation around like when he can go and he felt more comfortable. But I think the modeling part is such an important part that we don't realize.
100.
Even little moments that we don't realize, like you said, like this morning, my son dropped an egg on the floor, like not boiled, so it made a mess. And it's just like saying out loud, like, oh, that's so frustrating. Like I just cleaned the floors last night, like now I have to clean again. And just saying it out loud. And I love the fact that asking them to guide you. I could have done that as well, where it's like, what should I do now? I'm really frustrated because I have to clean it again. Just getting their guidance, and then it won't feel as foreign when you say it to them next time.
Yep.
Yeah, I get that.
100%. I love that.
Do you recommend some sort of areas when you work with children? Like, do calm down corners work for, I'm assuming not all kids, but is that something recommended?
Yeah, if that works, calm down corner. Sometimes I just do calm down boxes or bags because that's kind of translatable, right? You can kind of put it in your bag. They can bring it to school. Like, so whatever works. I just tell parents like exactly what you're saying. Just because you have this awesome set of tools doesn't know they know how to use it. Two, they might not want to use it. Why do I have to do this? Right? Like that thought. And so like, again, it goes back to that practice. Like, I think it's helpful for everyone. Like, there are definitely things that help me calm down, whether it's like fidgeting with something or taking a deep breath. But I have to really be intentional about like knowing it's there and practicing it. And the same for our kids. And so we want to normalize it. We want it to be familiar, something that's just kind of a natural part of this is what I do when I'm frustrated. And I do think it would be helpful for most kids.
I love that. I'm thinking of a situation where a child might look like they're misbehaving, but there's an underlying issue. You know, maybe it's worry or anxiety around something. How do we, I'm thinking about that you use the scientist thing, right? So if we're taking notes and we're trying to understand the behavior and we notice it's when they have to get ready for school or go to grandma and grandpa's house. I don't know. Let's just say certain situations. And we notice that. How do we approach that if we're noticing their behavior changes when they have to do certain things?
I love that because, like the whole purpose of that is because it's so overwhelming for them that like they kind of collapse. So I think about using coping strategies, right? Like, how do we help manage our stress? I think about like worry sometimes as like a thermometer or like our cup being filled. And those moments are like big rain, pouring rain into our cups or whatnot. And so I think about how do we help them learn how to empty it and have like, for example, that might be helpful thoughts, right? That might be even just acknowledging their feelings. Just because they're worried doesn't mean they know they're worried. And what is worry, like, and being able to talk, there's like worry bug exercises out there where you can talk about having worry bugs and how that feels in their tummy and being able to recognize that early on and being able to express their thoughts. What about going out is really scary, or going to school? Is it I'm afraid that my friends are going to make fun of me? Is it because I'm worried the teacher's going to call on me? I think there's a lot of things that then we can unpack and move on from there. So just really thinking, continue being that scientist and then helping them develop the skills to kind of start pouring out some of those stress and some of those like worries from that cup of theirs that feels overflowing in that moment, and ahead of time as well. So,
and with the same rule as the beginning that you mentioned at the start, would that apply in terms of functioning? So if a child is still going to daycare or still going to school, but clearly worried by showing us through their behavior, versus a child refusing to go to school or daycare and really acting out, is that when we would seek help, even though we don't know if they'll have a diagnosis, but it's just about getting help?
Yep. Yeah, I definitely. I think even then, like I've often created kind of separation plans for separation anxiety for a parent and with a teacher. I've called up schools before to make sure we're all on the same page, and then having, routines in place that really support kids and being able to cope with those big feelings that come up when separating from, someone they love, their parents and caregivers. So definitely is something that people can seek help for.
Would the same apply for, or maybe you have tips for nighttime? I think this is a struggle for a lot of parents. Nighttime is something where, again, you know that it's linked to not wanting to be in bed alone or in the dark, and it comes out as behavior because you're just like, it's the end of the day, I need you to go to bed. And you're like, there's no way you're leaving me here alone. And it becomes like this battle, and it becomes a behavior thing and a discipline thing when it shouldn't be, but it's so hard. It's such a hard moment for parents. How would we approach that?
A lot of sleep issues come up. I do think going to your pediatrician first is helpful because sometimes there are underlying medical issues involved with sleep difficulties. And so just making sure we talk through it is helpful, but often it's behaviors, like you're saying, it's big feelings, or I still feel a lot of energy in my body. And that's when psychologists can be helpful in creating like a behavior plan for you to try. And I always tell families, I might be a quote unquote expert on like child development, but at the end of the day, you are the expert on your child. And so that plan is going to take some tweaking, and us putting our heads together and perfecting to make sure that it fits with your child, it fits with your family. You might have multiple kids and you cannot devote all your attention at night to one child. And like working around all of that. And so I definitely think psychologists do that a lot. And there are specifically pediatric sleep psychologists who do this just for a living. It's just focus on sleep. Yeah. So
Every parent should have one dedicated to their house.
I know. I went on call. Okay, they're not going to bed.
Yeah. 3 numbers on your phone and they're on the other line.
Yep, that'd be nice.
So hard. I think you just mentioned settling down. Again, that might come out as behavior, and it's whether it's during the day or later in the evening.
Yeah.
Is that an emotion thing, and like an emotion regulation thing, where a child needs to learn how to calm down at some point because their body's filled with energy? And how do we approach that situation where, again, they're just running around, jumping on couches or jumping off of the couch, and you're like, sit down, and they're just filled with energy. How do we approach that kind of behavior?
Yeah, I think my first always go-to recommendation is routine. So if you're going to bed at 7 tonight and then 10 tomorrow and then 8:30, our bodies just are not built or wired for that, right? So at most, I always tell my families shift bedtimes by 15 to 20 minutes was the healthy expectation. So especially now as we're transitioning into the school year, if your child's been sleeping at 10, it's not going to be very much possible for them to sleep at 8 tonight, because our bodies don't shift. And that's why we have jet lag. And so having a routine is helpful. And then building a routine to not just to the time is also helpful, right? So there are things we do that gets ourselves sleepy because in our brains, we associate that with bedtime. And so having we first take a bath, then we put on our jammies, and then we read a book, having that order of events and making that a part of the routine is helpful just for kids to know all right, it's time for my bodies to calm down. We're just subconsciously telling them that. And so I think setting up those things is helpful. And then families will start to notice sometimes too, there are things that kids do that may help or not help them, such as naps when they're taking naps, or spending time outside, or if they're having dessert at night, things like that we just, as we get to know our child, we start to notice those patterns. But it's hard to notice them if you don't have a routine. So I'd first start there if you don't have one already.
That's really good advice. And it's true. The routine makes a huge difference, especially in the summer. We see a difference in behavior. I find sometimes we're skipping naps because it's a nice day. We're going to bed late because, we're just staying up, having fun with neighbors and stuff. And you see a difference in their behavior. So I think it's important for us to realize that and try to get back to the routine as much as possible. I know it's just for the summer, but yeah. Yeah, I know.
Exactly.
I think the last behavior that I wanted to chat about with you today is the impulsivity. Because again, it comes in and didn't you think about that? I keep telling you to not do that. Or it could, sometimes it's even hard to recognize, is it defiance? Are they ignoring, or is it impulsivity? So how does what advice can you give to a parent to kind of realize that it is a child who's being impulsive rather than defiant? And what can we do to help them build that skill?
Yeah, I think impulsivity, we all attention span is something that we built. So I think first really understanding that again, this is something that works, but often it also comes with a cluster of other symptoms, right? Kids who are very impulsive might also be very hyperactive. So they're having a hard time sitting in their chairs when their peers might be able to do it, or they're fidgeting, or they're blurting out answers. Those are impulsivity. Or they're, grabbing for things. You're plating food on and the food isn't even on the plate and they're already grabbing at it. Those are all signs of impulsivity. There's things we can do to help them learn to wait. Again, that's practice. And you can practice waiting for a certain amount of time with a timer. And then after the timer goes off, that's a little bit more structured. But there's other things we can do, in play, holding on to something, and you're filling in the spaces for them when I'm doing this. I'm talking to them, I'm helping them be able to distract themselves, right? That's a strategy as we learn to wait. So I'm teaching those strategies to them subconsciously. And usually for impulsivity, I think it's helpful to work again with, a professional. And I think I just wanted to pause for a moment to say that not all child therapists and child psychologists are the same. Not everyone is the age range we're talking about, and a lot of child psychologists are not as familiar with the younger kids. Many are trained in more kind of talk therapy approaches of like, let's talk through our feelings, which I will let you know, it is not very helpful when you're 2s, 3s, 4s, 5s, because they cannot hold it. Even precocious 7 and 8 year olds sometimes struggle because cognitively that's not what they're at. And so I personally like behavior treatments where parents are huge components of it. So I'm kind of teaching parents the skills I use to help kids learn to wait or to learn to listen. And then you get to go home, try it out, tell me where the hiccups are, and we get to work through that. But because kids learn through that like repetition and the behavior. And so that's why behavior therapy is more helpful for younger kids and all the other concerns that we're talking about. As they get older, then they're, usually a better candidate for more talk-based therapies to process through things. But at younger ages, behavior therapy is a lot more evidence-based and effective. So I would think about that. And then if it's impulsivity is getting in the way of daily life, I would go talk with their pediatrician. Kids do, ADHD. It's a big profile, a part of the profile in a lot of kids with ADHD is that impulsivity. And so even if your child doesn't have ADHD, sometimes getting the therapies that kids with ADHD go through to learn those skills, right? You don't need a diagnosis. The diagnosis is just helpful for billing, to be honest, for your insurance coverage. That's where I really spend my time thinking about diagnosis is for that billing. But at the end of the day, all we really want to do is understand our child, their strengths, their weaknesses. Why do they do these things that I can't quite wrap my head around? And what do I do about it? Like, I think as parents, that's the thing we care most about rather than a label. And it's how do we understand and help our child? And seek someone out to talk about that is helpful sometimes.
What if a parent has already begun seeing a therapist for their child and now they're, 4 or 5 weeks into it and haven't noticed any difference? Is it too early to notice a difference? Or, how long should they wait before they say, well, maybe this person in particular wasn't the best one for our family? And you know what I mean? Like what sort of timeline should they be looking at? Or signs they need to maybe switch?
Yeah. I would just say, timelines are hard because kids that might be experiencing stressors or there's other things going on that changes timelines for every child, like their developmental levels. But I think when I think about a good fit of a therapist is one, I believe for all child therapy, parents should be a huge component. Sometimes I ask parents what their kids are up to in therapy and they can't give me an answer. And for me, I'm like, oh, then it's really hard to tell. Like, because there's no magic in 1 hour a week with a therapist. It's really about how do we use that to impact every other hour in the day. And so if we don't know, it's really hard to help kids be able to translate what they're processing or what they're learning in therapy to other aspects of their life. And that's what all we want, right, is to support them. And so I would think one, like, do you know what's going on in that 4 weeks that has been happening? Being able to talk with a therapist about it. I really appreciate conversations with my patients when they're like, I'm not sure this is working, or I'm really nervous about getting this assessment from you or whatever, because I really value those feelings. They're valid and they impact treatment, and they, this is your lives here and your child's life. And I want to be able to support you. And I hope that you can find a therapist who do feel comfortable with you bringing up your hard feelings and thoughts and not taking it personally, and being able to explore fit together. I think that flexibility, especially, this goes on another tangent, but, a lot of therapies are built for a certain demographic and most people don't fit in that demographic. And so having a therapist who knows how to tailor it to your family, the number of kids, your cultural background, what your parenting values are, I think it's really important. So I would focus less on that progress at the 4-week mark. I would focus more about how do I feel about having this person as part of my team in helping my child. Do I feel like we are teammates and I feel like we can learn to tackle this thing together? If not, then really thinking about, can we make that shift to being on the same team together? And if not, maybe it is time to think about another therapist.
I'm curious from your point of view, though. You just got me curious about something. When you're working with a family, I'm sure that you could see when the work is being done at home, right? Because like you said, that 1 hour is nothing, really, not nothing, but they need to do the work at home. Are you able to tell the difference between a family who's doing the hard work at home? Yeah.
100%. Families come in and they're like, okay, how soon can you make my child, not have a tantrum? And we have to explore that a lot. And I'm like, well, first, I'm not treating your child. It doesn't matter if your child listens to me and never have tantrums with me because I don't get to go home with you. And then the second part of that is like, it's how hard, you're able to learn these skills to support your child. And so I have had families go through the same course of treatment with like starting out with the same amount of like intensity in their tantrums, maybe 3 weeks and they're 3 months and they're done. And then some families are like 6 months and they're still like really struggling. And that's okay too. Like you don't have to be that 3 month family because you might have other things going on. You might be navigating a move or you're dealing with, life stressors or other things, other children. You have your life too. There's other components. But just recognizing that how much you pour into therapy, you get on the receiving end, and just be open with your therapist about that, because sometimes it's better to wait a few months and then find a good time to target it. But your therapist should be able to support you in finding that like optimal moments for having some therapy work done.
And I like that you're really stressing the time and that it shouldn't be about the time because every child is different. And even if you think about like starting a new workout at the gym or you haven't been there in 3 years, let's say 3 years with the pandemic, and then you go back and like, oh, this is really hard. And then it's like 3 months into it and you're like, nothing has changed. But then like the fourth month is where you really see the difference. I guess it's the same thing. Like you just don't know what the amount of months are or weeks or whatever it is for your own child. But we have to be consistent with the work that we're doing with them and whatever you're suggesting, because we won't see the results.
Yeah, and I want to stress something that I tell a lot of families is that when you're doing the right things, tantrums will get worse before they get better, and just hold that in your head. Yeah. So think about it. If a child is like, let's say classic example, they're crying 10 minutes to get ice cream, and you're not giving it to them. Because you're learning to be selective. I'm holding my boundaries. I'm doing everything, that the literature, the therapist, whoever told you to do. They're going to cry for 15 minutes. They're going to cry for 20 minutes because they're going to see like, how long do I cry before mom gives me that ice cream? And that's when you held on, because it's the worst time ever. And you feel really bad on the inside sometimes, but you got to tell yourself, I'm a success, because then they're going to learn, even if I cry 20 and 30 minutes, that ice cream is not coming until like after dinner or whenever. And they'll stop crying because they're learning crying is not an effective way to get ice cream. Maybe I should politely ask for it. So just knowing that, and don't give in, because if you get in at the 30-minute mark, for example, what they learn is I have the ability to cry 30 minutes, maybe even 45. So the next time you're going to have to hold on even longer. We call this the extinction burst. But like, tantrums will get worse before they get better. It means you're doing the right things. So yeah.
And I think to end our conversation also, the parent has a huge role. Like you're not, I think that's not a misconception, but like you said, they come sometimes and they're like, how do you end tantrums like tomorrow? Like, how do I
or yesterday.
Or yesterday. Like I just they have to end today. I get that. And I get that, I've been in the same boat with my kids, and it's not easy, but it's also, for me, what I learned as a parent is that there was a lot of unlearning and learning on my end as a mom, like how was I raised? How were emotions perceived in my own home when I was growing up? And then how was I viewing their emotions or getting triggered by certain things that I hadn't recognized? So I had to go to therapy myself, and that's what helped me parent my child. So the parents, we play a big role in this.
It's huge, and it's complex because we have our own histories, right? And we have our own experiences. We have values that may or may not match all the other caregivers' values and what we're hearing on Instagram and other places. And we have to figure that out, and the feelings that come with it. Like there's a lot of work to be done, and parents have the harder jobs because, like, as a therapist, I only get that 1 hour, right? And it's contained. And I think your kid is adorable and sweet, and I really adore them, but it's not the same love that a parent has with their child. And so that emotional energy is going to feel different for someone else than for you. And it's okay that like you need that learning curve and to get support on your own. I love that you brought that up, Cindy.
I love that.
Yeah.
One last thing, turtle time to calm down. What is that? I saw it on your feed and I thought that maybe it would be a really good last tip for parents that are listening.
Yeah, I love different mindfulness tricks. I think mindfulness, there's so much literature out there on how we calm our bodies and deep breaths and really grounding our mind, and how that's great for us generally for stress, anxiety, with our big feelings. And kids benefit from that, except sometimes it's really abstract for kids. So I love posting a little bit on different strategies to help it become a bit more tangible, a bit more concrete. And so turtle time to calm down is just like imagining that you are a turtle whenever you have those big feelings, and knowing that you can close your eyes and kind of like pull yourself in, your arms and your head and your legs into your shell, and to practice taking that deep breath, and really being able to check in with your body when you're in that safe space, because then we bring our safe space with us, right? It doesn't have to be, that calm down corner or our bedroom. We can close our eyes and we can decorate the inside. We can be really creative with this. And then you get to like peek out your head when you're ready, out of your shell, assess like, is this safe? Can I come back? Am I ready? And it's okay not to be ready. If you need to, you can go back in, you can relax your muscles, you can do whatever you need, and keep repeating that until you feel like I'm in a space where I feel safe enough to stick out my limbs, my head, and to rejoin the world outside me. So yeah, it's a fun exercise.
Even just hearing you explain it felt soothing to know that, like you said, your safe space is you. It could be you, and not having to look for something external. I love it. Thank you for everything that you do and everything that you share with us on Instagram. Where can listeners find you or learn from you?
Yeah, well, on Instagram, I'm at Parenting the Unexpected, because I want to help parents parent the unexpected moments. So you can find me there, and some tips on my IG as well. So yeah.
Thank you so much. And we definitely have to have another chat.
Yes, soon. So thanks, Cindy.